Morrison, are you ready to go? Okay. Well, good afternoon, everyone, and thank you very much again for joining us. Today, we have Dr. Morrison here, our Chief Public Health Officer, and we're joined online by Dr. Marguerite Cameron, our Provincial Epidemiologist with CPHO. In a few moments, Dr. Morrison will provide her regular COVID update, and then following that, Dr. Morrison and Dr. Cameron will provide a further epi update and lay out what we are calling a three-step plan that they have outlined to help every islander walk through and eventually out of COVID restrictions in our province. The components of the plan, based on the epidemiology in our province, in the region, and across the country, the components were presented to Provincial Cabinet this morning and were approved. I would just say that, again, that I know this has been a grind for everyone, 23 months of it and counting. We've talked a lot about being almost through this, and now this plan puts some firmer timelines around exactly what that means and what it will look like. As Dr. Morrison will outline in greater detail, the plan will begin with step one on February the 17th, with some further relaxing of our public health protocols. Step two will see further relaxing again in mid-March, and step three will see an end to most of our public health restrictions, and that date, as of today, is targeted to be on or around April 7th. Now, a couple of points, and to be crystal clear, this is not a declaration that COVID is over, or that COVID will disappear, or that we are standing here and saying mission accomplished. COVID is with us, and it will be with us. We will begin likely to talk about it less on a daily basis. We might have less direct daily focus on it from an individual or family perspective, but COVID will continue to be here. Our province will deal with it through our health system. We will monitor it like we monitor all communicable viruses and infectious diseases, and if and when we need to act, we will. It means that the publicly mandated health measures, most of them that have been with us for the last 23 months, will be phased out. We will continue as a government, as a health system, to promote the vaccines, the boosters, and further annual boosters if that is what's recommended. We will continue to recommend that individuals be mindful and careful with personal masking and other measures. And there are likely to be measures in some of our high-risk settings like hospitals and long-term care facilities that will extend beyond April 7th and are likely to become part of our everyday operations into the future. And the second thing is that these timelines are subject to continuing on the trends that we are on, and the public following the recommendations around protocols and vaccinations. We know the science is clear and without dispute that the vaccines help prevent serious outcomes if you contract COVID-19. The proof is that all islanders should be looking at it directly in the face, that since the beginning of the COVID pandemic in this province, we've had over 9,000 cases of COVID, and over 95% of those cases have occurred in the last 2 months. And because we've had such protection from the vaccines that over 95% of islanders have stepped up to get, we have been able to prevent countless hospitalizations. We will never be able to fully quantify the number of lives that we saved, but I need every single islander to know that those of you who rolled up your sleeves to get vaccinated, for yourself, for your family, and for your community, you have made an immeasurable difference. You have kept your province and its citizens, your friends, your neighbors, and your siblings safer. And there can never be enough words of thanks or gratitude that I have, that we have, to all of you for such selfless endeavor. I think we are at a point, and Dr. Morrison and I have talked about it for weeks, when the epidemiology and the trends across the country, the region, and the province can allow us to look a little more firmly at our long-awaited return to life without COVID restrictions. I know each and every one of you, as patient and understanding as you have been, look forward to that day as well. And while today's news, I believe, will be very hopeful, we can't lose sight of the fact that we need to be ever mindful and careful of COVID-19 in this province, and we can't let our guard down, especially this close to the end date or the hopeful end date that we are talking about today. So with that and much hype, Dr. Morrison, I'll turn it over to you, and you can talk about COVID, and then you and Dr. Cameron can talk about our plan.
Thank you, Premier. Good afternoon. The last 2.5 months have been especially challenging for all Islanders, and I know everyone is tired and weary of COVID after 23 months of this global pandemic. And today is a time when we cautiously look forward with hope and optimism as we discuss living with COVID-19 as an endemic disease, meaning it will remain part of what is circulating in our province, but we will live with it differently. As of 8 o'clock this morning, there are 264 new cases of COVID-19 to report, bringing our total active cases to 1,819 and 268 recovered or resolved since yesterday's reporting. Over the last 7 days, we've had an average of 175 cases a day. Presently, there are 9 people in hospital being treated for COVID-19, including 1 in intensive care. And in addition, there are 5 people in hospital who were admitted for other reasons and were COVID-19 positive on admission or tested positive after admission. There is 1 new death to report, an individual over the age of 80 years. My condolences to the family and loved ones who are mourning the loss of this individual. We all share in your loss. In the last week, we reported 1,325 cases. 30% of these cases were in children and youth age 18 and under, and 46% were in adults between the ages of 19 and 49, and the remainder were in individuals over the age of 50 years. Public and private schools resumed in-class learning on January 31st. As we expected, there were a few bumps in the road, but thanks to the hard work and support of students, families, and staff, all schools remain open. The most recent data I have seen indicates that a total of 89 students have tested positive and 11 staff members in 37 schools across PEI. In terms of outbreaks, there are outbreaks in 7 long-term care facilities. There is an outbreak at 1 community care facility. As of this morning, there are 20 early learning childcare centers with cases or outbreaks. 7 centers are open, 13 are open with modified or limited services, and no centers are closed. There are outbreaks in other congregate settings, including the population that accesses shelter and outreach services in Charlottetown and the Prince County Correctional Center. There are outbreaks at Community Hospital Leary and Prince County Hospital. We've had questions regarding outbreaks in long-term care and community care facilities. Current outbreak guidance states an outbreak may be declared over when 14 days have passed since the last case was detected or the last date that others were potentially exposed to a case when infectious. When a facility-based outbreak is over, a summary will be posted on the provincial website, and a number of these summaries have been posted today or being posted this afternoon on the website. For example, the outbreak at Miscush Villa was declared over on January 28th. 9 residents and 6 staff members were positive. And cases among staff may include some cases that were acquired in the community, as it's not always possible to identify how or where a staff member contracted the virus. The outbreak at Bevin Lodge was declared over on February 6th, and 17 residents and fewer than 5 staff were positive. When there are only 1 to 4 cases, the number will be reported as fewer than 5 individuals, so that individuals themselves cannot be identified. Once a week, a summary of cases by facility will be posted on the website. The first summary will be posted later this week. Due to our small numbers and the need to protect privacy, COVID-related deaths of long-term care residents will not be shared on a facility-by-facility basis, but rather will be posted as an aggregate number. We've also had questions regarding the use of the terminology when reporting resolved or recovered cases. The term recovered means an individual is no longer considered infectious. A case is considered recovered or resolved when 10 days have passed since the date of the positive COVID-19 test. And this same language and terminology is used for reporting across the country. The term recovered or resolved was developed for the purposes of surveillance and monitoring and is not related to clinical management of individual cases. We are very aware that some individuals experience symptoms of COVID-19 long after the infectious period has passed. I've spoken about post-acute COVID-19 condition or long COVID previously. While there's still much that is unknown about this condition, the emerging evidence suggests certainly that a significant percentage of individuals who've had COVID-19 reported the presence of one or more symptoms up to 12 weeks after diagnosis, and 1 in 10 people experience symptoms beyond 12 weeks. Individuals with long COVID experience a broad range of symptoms that impair cognitive and physical functioning, including fatigue, general pain and discomfort, shortness of breath, sleep disturbances, anxiety, depression, and cough. Vaccination with at least 2 doses of COVID-19 vaccine is likely protective against the development of long COVID, and there have been some recent studies to indicate that. Individuals who tested positive for COVID-19 and are experiencing symptoms beyond 10 to 14 days should seek medical care. For some people, post-acute COVID-19 condition is debilitating, interfering with many aspects of life. We cannot predict who will get long COVID, including children, and we do not fully understand why it occurs. The best protection against long COVID is to take steps to avoid contracting the virus. Getting vaccinated, including a booster when eligible, wearing a mask in indoor public places, keeping your circle of contacts small, stay home when not feeling well, and wash your hands. And certainly getting tested at a clinic if you have symptoms of COVID-19. If you do get COVID-19, you can protect others by staying home when ill and notifying your close contacts if you test positive for the virus. And these are all the same things we've been talking about for a long time. At many, many points during this wave of COVID-19, I have felt grateful for our ready access to safe and effective vaccines and for such a high rate of full vaccination among the population. And as the Premier mentioned, I've also felt grateful and relieved that our vaccines are working. We've had over 9,300 cases, with most occurring since December 2021, and only 45 people requiring hospital care, 8 in the ICU, and a total of 13 deaths. The most vulnerable to COVID-19 are our loved ones living in long-term and community care homes. They have a high rate of vaccine, including booster doses, and the vast majority of those who tested positive were able to remain in their homes and recover in place. The impact of the Omicron wave in PEI would have been devastating without the protection offered by the vaccines, especially the protection against severe outcomes, including hospitalizations and deaths. There is growing evidence that COVID-19 incidence rates and hospitalization rates, as well as ICU admissions and deaths, are higher in the unvaccinated compared to the vaccinated population. We are learning always about the importance of getting our booster doses when we are eligible. Third doses provide protection against severe outcomes, including hospitalization. Receiving a third dose is especially important for anyone who is immunocompromised or over the age of 50 because the risk of needing hospital care related to COVID-19 is greater. We know that vaccine effectiveness wanes 6 months after the second dose. Getting a booster restores protection against Omicron, provides extra protection against severe outcomes. As of Monday, February 6th, we have 93.5% of eligible Islanders 12 and older who've received 2 doses of vaccine, and 65.7% of children aged 5 to 11 have had at least 1 dose of vaccine. But as I mentioned last week, the rate of vaccine uptake among 5 to 11-year-olds has slowed considerably. I urge parents and guardians of children aged 5 to 11 who have not yet done so to make an appointment to have their child immunized and to please do so as soon as possible, and really to do so to protect them from any serious outcomes related to COVID-19. So I'm going to stop there and move to the anticipated transition planning part of the presentation. And some of you may remember almost a year ago when we at that time didn't anticipate the Delta variant and the Omicron variant. We had a moving forward plan that we had talked about. And this is a new plan that is called Moving On, and a transition plan to living with COVID-19. And it comes, I think, as the Premier mentioned, with hope and optimism. And it's really to share the planning for transitioning from pandemic to a recovery, including measures for businesses, gatherings, and travel. And I think the key word is transition. The plan is not about signaling victory or the end of COVID-19, but it's hopeful that we may be ready to move on. And although COVID-19 isn't going anywhere, we certainly have tools and information now, much more than we did before. This plan really highlights how we will plan to ease out of current measures and live with this virus as COVID-19 becomes endemic, not only here in PEI, but in the country. We'll be not returning to our pre-pandemic state for some time, as the Premier indicated as well, but we will be transitioning to live with it. Our focus will be less on restrictions and more on the things we've talked about, immunization, self-management, and protecting the vulnerable, more population-based approaches. So I'm going to turn it over on this next slide to Dr. Cameron, who'll speak to the first few slides on the epidemiology. So, Dr. Cameron?
Thank you, Dr. Morrison, and good afternoon, everyone. Can you hear me okay?
Yes.
Thank you. So this first figure captures our epidemic curve for PEI beginning on November 17th, and really it captures the Omicron wave here in PEI. So the orange bars display our daily case counts, and the black line would be our 7-day rolling average of new cases. And so it's this black line that we really look to when we're looking for trends for cases in PEI for our indicator. And as you can see from the black line, we have passed the peak of this Omicron wave in PEI, and in the last 2 weeks have seen a gradual decline in the number of cases being reported on a daily basis. So today we are reporting a daily average of 175 new cases over the past 7 days. And last week, that average was 226 new cases per day. Next slide, please. So this is a figure looking at the number of tests conducted each day, as well as the percent positivity among those tests. So the orange bars once again capture the daily number of tests that are conducted in PEI, with the vertical axis on the left. And then that black line is the percent positivity among those tests, and the vertical axis on the right captures that percent positivity. And what this figure really shows is that our testing numbers have been high. And although we are seeing a bit of a decline in daily testing rates, the testing rate per population in PEI remains very high and is above the national average. You can also see using the black line that we have an increase in our test positivity beginning in mid-December. And I will also note that it was in mid-December that we saw Omicron sort of take over the pandemic here in PEI, making up more than 90% of all the cases being reported. So percent positivity peaked at around 21% in mid to late January. And since that time, it has stabilized, hovering around 19%. There are a few dips here and there where the testing numbers were impacted by storm closures of the testing clinics. So the current average test positivity over the past 7 days is 16.6%. Last week, that value was 19.7%. Next slide, please. So this is looking at our outbreaks. These are institutional outbreaks. So that would include settings such as long-term care facilities, community care facilities, correctional centers, as well as acute care facilities. And so similar to the first two indicators, we are seeing fewer outbreaks in these institutional settings. In the second last week of January, we reported 11 new outbreaks. Last week, that number was down to 5. So this is one that we keep a close watch on as well, but I will note that with some small numbers, it's not unusual to see some up and downs. It's a little bit more challenging to look at trends with smaller numbers. Next slide, please. Finally, this is a figure displaying the daily counts of individuals in hospital being treated for COVID-19, as well as that 7-day average captured by the blue line. And from this figure, it appears that we have reached our peak with regards to hospitalizations. And similar to what we are seeing with our daily case numbers, we are now seeing early signs of a decline or a downward trend in our daily hospitalizations as well. Today, we are reporting an average of 12 people being treated in hospital over the last 7 days. And last week, that average was 15 individuals. Back over to you, Dr. Morrison.
Thank you, Dr. Cameron. And we thought it was good to just highlight some of the indicators that we continue to look at, because I do think those are what we've talked about before, we continue to monitor. So the COVID-19 situation has continued to evolve over the past 2 years, and our approach in PEI and our measures have evolved with it as we balance the protection of the health of all islanders with minimizing societal disruption. This plan is based on the best available evidence and ongoing risk assessment. And as the Premier and I said on our way down here, as with every other announcement, some people will want these steps to move faster and others will want us to slow down. This plan is built on the steady and cautious approach that we have used really throughout this pandemic. Some of the changes since PEI's 2021 Moving Forward plan, when it was released, some of these changes include we've achieved very high rates of vaccination in PEI, and vaccines are now available for children aged 5 to 11. There are more transmissible variants of concern, the Delta and Omicron, which have emerged, and currently Omicron is the dominant strain in circulation across the globe. We know more about how the vaccines protect against serious infection, hospitalization, and death from various variants of COVID-19. Oral antiviral treatments and monoclonal antibody therapies are available now for adults without contraindications to help minimize severe outcomes, including hospitalizations. Omicron has resulted in the first wave of community transmission of COVID-19 infection in PEI, with outbreaks, hospitalizations, and the first deaths related to COVID-19. PEI has needed to respond to this wave by re-implementing restrictions and public health measures. Our health system has been challenged over the last few months. All aspects of our system have been strained. We know that public health measures implemented to minimize the impact of COVID-19 can have significant unintended impacts on mental and physical health, children's learning and development, and the economy. As the world prepares to enter its third year of the COVID-19 pandemic, planning to live with COVID-19 and potentially new variants is necessary in the years to come. So all of these factors have led to the need for a new plan to ease public health measures over the coming weeks and months, and ultimately transition out of a state of emergency response to the COVID-19 pandemic, and that's a public health state of emergency, to where COVID-19 will continue to circulate, but where vaccines and treatments to protect against severe illness exist. So implementation of this plan is informed by trends that we've just reviewed in key indicators, including our cases, our percent positivity, new outbreaks, hospitalizations, and our COVID situation locally, nationally, and internationally. An ongoing vaccine uptake amongst island residents is critical, including booster doses for those 50 years of age and older. We've talked about our general public health measures such as physical distancing and masking, as well as testing, will continue to provide a solid foundation for the easing of these measures over the next weeks. Going forward, we will watch for emerging variants with increased risk of severe disease and monitor and control outbreaks in vulnerable populations. We will need to continue to be prepared to respond as there may be surges in COVID-19 activity and strain our health system. Vaccine recommendations will also continue to evolve. And as the Premier mentioned, these are the anticipated dates of our three-step plan. And these will be progressive lifting of restrictions, 3 to 4 weeks between steps, and we will adjust if we need to. And the dates for Step 2 and Step 3 will be confirmed prior to those start dates. The guidance for all the steps include getting vaccinated and boosted, assessing the risk to yourself and to others for participating in activities. Vulnerable individuals should exercise caution and minimize high-risk exposures situations, stay home when unwell, and outdoor activities are lower risk than indoor smaller gatherings. And the indoor gatherings certainly have a slightly higher risk than outdoor gatherings. In Step 1, family and friends will move from a household plus 10 to a gathering limit of 20 people. In terms of organized gatherings, and these include worship services, wedding and wedding ceremonies, spectator activities, and concerts will move from 50 people maximum to 50% capacity. And there'll be no strict requirement for distancing. Rather, organizers will be required to maximize use of space to allow for as much distancing as possible. People will be mostly seated and masked for these activities. In terms of sport and recreation, games and competitions can begin up to 50 individuals over a day. This includes interprovincial games, so regular league play can occur, and smaller competitions for non-team sports or small team sports, but no large tournaments. No more restriction on travel off-island for sport and recreation. Spectators at sport and recreation up to a 50% capacity with as much distancing as possible. Wedding receptions and dances will be permitted up to a total of 50 people where interaction is within that 6 feet. Restaurants, fitness facilities, retail, and other venues including museums, casinos at 50% capacity with space maximized to spread people out as much as possible. The PEI VaxPass will remain in effect for discretionary activities. And I know this is the one we've got getting a lot of questions on. No isolation for fully vaccinated travelers arriving in PEI with testing on entry, and of course the antigen test being given for days 2 and 4. Step 2 will increase the personal gathering limit outdoors up to 50 people. Organized gatherings, the capacity will move from 50% to 75%, and there will be no strict requirement for distancing. Rather, organizers, again, will be required to maximize use of space to allow for as much distancing as possible. And in terms of sport and recreation, there'll be interaction, of course, within that 6 feet for up to 100 individuals per day, including interprovincial games. Spectators at sport and recreational facilities, again, it'll be based in terms of spectators on a capacity. Wedding receptions and dances will be permitted up to a max of 100 people. And restaurants, fitness facilities, retail, and other venues at 75% capacity with space maximized to spread people out as much as possible. And the PEI VaxPass will be in effect for applicable activities and gatherings only over 200 people. And we'll be moving to testing of travelers, all travelers, and in step 2 as well at the point of entry. And step 3, estimated around the 7th of April, we anticipate further relaxation of measures where we would not have mandatory masking, but it would be recommended in indoor public places. There would be no testing and screening at points of entry and no gathering limits. Our aim is to phase out these public health measures at the earliest possible time. And this is also of interest to me personally. The press briefings and releases would be as needed with web updates weekly. So I think my final slide is this really these steps we've all taken together and continue to take have helped preserve our health system capacity and protect our most vulnerable. And these will still be priorities moving forward. And this is a hopeful plan, and we'll walk forward and move on carefully. And I think there are still many unknowns, and this plan will be adjusted as necessary. I would mention that in terms of schools, childcare, long-term care, and changes in terms of case and contact management, we will likely be able to update those as part of that moving on plan next week. And we'll continue to evolve with the evolution of the virus. So as we look forward and look ahead with cautious optimism and hope, it is important to recognize that COVID-19 is not over, and that well into the future we will continue to take steps to prevent transmission. Going forward, vaccines will continue to be a cornerstone of how we can protect ourselves and others. As the virus evolves, so will our immunity and vaccine recommendations. We each have a continued personal responsibility to limit transmission and illness related to COVID-19. And we do that assessment on all the things we've talked about, staying home when we're not feeling well, et cetera, when we are assessing our own level of risk and that of others, and when we decide to attend an event or gathering. We would not be here today announcing a plan to ease measures and move towards living with COVID-19 without the steadfast support and resilience of Islanders over the last 2 years. Words cannot express my thanks to each and every Islander who has stepped up in whatever capacity that has been and did what they needed to do to protect and support themselves and others, even when it was really challenging to do so. During the last 2 years, we've all had to do a lot of things that we did not necessarily want to do, but we did the right thing, putting the interest of others ahead of ourselves. Without the cooperation of Islanders throughout the pandemic, we would be in a very different and less favorable position today. As we navigate through this, it has to be our last and tumultuous leg of this journey. Let us continue to be patient and kind. Thank you.
Thank you so very much, Dr. Morrison and Dr. Cameron. We will now turn it over to questions from our friends in the media. We'll start with those who are here, and maybe with Brittany Spencer, CBC.
Thank you. So I'm just wondering, as we move towards our first step and we see those easing of restrictions, how do you expect those indicators to change and that data to change once we open up a little bit more, get rid of isolation for traveling, allow larger personal gatherings? What do you expect to see when it comes to case numbers, hospitalizations, once we do that?
So it's a great question. I think what we certainly all the evidence right across the country, as we ease measures, we would anticipate there would be more cases. I think partly the restrictions we've had over the last couple of weeks have tried to make sure that if we do have more cases, we're able to manage them. And that's really one of the things we talked about when we put those in place. I think what has also happened over the last month has been we have more people boosted in the age categories that are more likely to have severe outcomes. So I think we're going to continue to watch that and see if we can, have all those measures that we've been talking about still give us the tools to minimize how things are spread, even despite loosening of these measures. And we'll continue to watch our hospitalizations, and that's why I think others have talked about it. And the Premier references too. I mean, I can't imagine someone working in the emergency department for a long time without wearing a mask. We used to go from patient to patient to see people without necessarily wearing a mask. Those will be things that will be there to stay. How we manage outbreaks and some of the infection prevention control measures in institutional settings, I think, will be present for a long time, and they'll be really important. And they'll be things that we've learned through COVID-19. So, long answer to say yes, I do expect some cases to go up, and that's what is anticipated. But I'm hoping that we'll be able to manage those cases and continue not to have our moving on plan impacted.
And now I know that just based on what we've seen happen in the past, putting dates and targets on steps to move forward, it doesn't always go according to plan.
Exactly.
So I'm wondering why now, why put those tentative dates in place, and how confident you are that you think we'll reach those targets?
Well, the Premier may want to answer this too. It's because we have had discussion about whether or not dates versus a general time. But I do think we're in a different stage of the pandemic. I think the Premier referenced Islanders are tired of this. I've talked about we're all tired of it. And I think having some firmer dates are important for businesses, for planning, for organizations, for all of us to think about what lies ahead. We've had to adjust dates, as you mentioned before, and we will again. But I think having some dates at this point may be helpful, and I don't know if you want to add to that.
Look, I think the only thing that I would add would be that we've essentially been on the trajectory to get to where we are. You've heard Dr. Morrison and me talk about being, able to have the ability to do this by spring, so whatever, like spring could mean something different for somebody else. I think we're just, my sense is Islanders need to know some firmer dates. I think that's quite obvious. I think that's probably consistent across the country that, individuals who have been through this for a long time, I think need to have, psychologically, they need to be able to see what that date is. April 7th doesn't seem that far away from today when you really think about it, but there is still a lot of work to be done. But I think that all of the factors that we outlined at the beginning allow us to have that comfort level, but there's much uncertainty for sure, and there will be some uncomfortable days, I'm sure, into the future. But I think Dr. Morrison and Dr. Cameron and their team never have yet come to Cabinet without a plan that was well thought out and very well planned. And for the most part, we've been able to meet every deadline or go a little faster with some of them. But their work is always very thorough. It's based on science. There's no emotion that's into it at all. So I have comfort when they bring that forward to me. And I just think it's incumbent upon each and every one of us, every Islander, to work as hard as we can to make sure we can meet those dates.
Now I'm curious about which will become important when we enter step one, the definition of fully vaccinated. I know that has been discussed in other jurisdictions and other provinces. What exactly is that definition? Would it be 2 doses or 3 doses? Can we expect that to change here on PEI?
So some of the other provinces have been discussing whether or not they will include the booster dose, even for their a Vax Pass or a Vax card. We have not done that here. We have a very high rate of, we still are using fully vaccinated with 2 doses, and really watching those booster rates come up right across the eligible population for boosters. So we are not changing the definition at this point, but certainly continuing to emphasize that having a booster will provide so much more protection against severe outcomes. And it's a concern when we hear people saying, well, we're this far in, maybe I won't bother getting the booster, and the protection is just not the same without the booster. So encourage people to do that. And we now have I don't know if I have every number, but we now have over 50% in every age category above 50. So, and that percentage is very high in some of those age categories. So we'll continue to watch that.
And now, this is my last question. I know that we've asked this question before. What would it take for us to not hit our next step, or to put those measures back in? That's very much been a moving sort of target throughout all of this. But what would that situation look like at this point?
Dr. Cameron, I don't want to forget about you. Would you like to take that question?
Sure, thank you so much. So that's a great question. And so, as Dr. Morrison had already indicated, we do anticipate seeing an increase in cases as we open up. Some key indicators to continue to monitor is certainly our rates of hospitalizations. And currently, the evidence would suggest that the impact of COVID-19, severe outcomes among children, are very rare. And so that's something that we keep a constant eye on as well, is there any evidence evolving around the impacts of COVID-19 on children with respect to severe outcomes? That's one that we look closely at as well. Another one would be emerging variants of concern. We know a great deal about Omicron, but there still is quite a bit left to learn. And so if there was anything to change with regards to the epidemiology around the variants that are circulating, that certainly would give us cause to reflect.
Okay, thank you.
Brittany, Allison Jenkins from The Guardian.
Most of my questions were already answered, but I do have a couple. Where are we at for vaccinations for children under 5? What's the latest telling you?
We've been sort of getting updates on where those studies are, and I don't anticipate anything in the next couple of months, but I do think there's sort of work underway, and that'll be the next probably big change in terms of vaccines, and we'll look forward to that when it comes. But once it gets approved by Health Canada, then there's also NACI will also have a look at it as well. So it's a bit of time before that happens.
So a while.
Yeah.
And I have all kinds of questions on this topic, but if you have contracted COVID before your booster, do you still recommend a booster? Mm-hmm. And if so, how long should you wait after testing positive?
So some of that has is also evolved with Omicron because the evidence has changed a little bit. But certainly with previous variants, the advice was clearly if you feel better after 10 days, 14 days after you've been COVID positive, you can get the vaccine or your booster. Now with Omicron, recently they've said, well, you can, wait until you're sort of 3 months after that. But again, it's sort of individual too. I mean, it may depend. It's not bad to get it before 3 months, but you can wait up to 3 months. And so that has also changed more recently. And what they're looking at specifically is basically how the virus, Omicron in particular, impacts your immunity. So getting a booster provides a lot more protection than just getting COVID on its own. So, and people say, well, if I already have COVID, maybe I don't need to be vaccinated. But they actually know that it doesn't provide the same kind of protection than having a booster does.
Okay. And can you elaborate on how the vaccine protects against long COVID? What have you heard about that? It sounds like there's not a lot, but what do you know?
So some of the recent studies have just suggested those who are vaccinated may be less prone to having long COVID. So those are fairly recent studies, and we'll continue to learn more because it's really been takes a long time to longer to assess that. But those are the recent studies that have indicated that.
Is there any, follow-up question on that, any relation between the severity of your COVID and the chance of having long COVID?
I'm not sure. Certainly, those who have more severe outcomes in terms of hospitalization may be more at risk. But in general, the people who are symptomatic, right throughout COVID, some people have been more symptomatic with COVID than others, and there doesn't seem to be a correlation that I'm aware of at this point.
Okay. Thank you.
You're welcome.
Julien, Radio-Canada.
Bonjour. I wish you can just translate all of the answers because it's exactly what I would like to ask to you. So I'm going to speak in both languages, but my first question is in French first.
Okay.
Depuis 2-3 semaines, chaque semaine que je vous vois, je vous demande, c'était le temps de fermer, c'était le temps de rouvrir. Aujourd'hui, c'est le temps d'aller de l'avant, de moving on, comme vous l'expliquez.
Ouais. Aujourd'hui est le temps d'annoncer que ça commence vraiment. Alors, je pense que c'est quelque chose de bon, vraiment. Et c'est pas que COVID-19 va disparaître, mais on va vivre avec. Et ça va pas être, on va pas avoir les mêmes mesures en place. Et je pense que tout le monde a hâte de vivre un peu plus normal, mais on veut arriver là vraiment aussitôt que possible, mais avec, il faut faire attention en même temps. Alors, j'espère on a les dates et j'espère que ça va fonctionner comme ça, mais on va continuer de faire attention aux indications que Dr. Cameron en parlait.
Vous m'avez dit la semaine dernière que la semaine, le 9 février, je pense qu'on est Est-ce qu'on est le 9 aujourd'hui? On est le 8. Le 9 février, vous m'avez dit que ça serait le pic des hospitalisations à l'île du Prince-Édouard. Est-ce que ça veut dire que là, le pic, on y est, on est dedans?
C'est vraiment, qu'on a montré le modeling, c'était la semaine entre le 9 et le 2 et le 9 février qu'on pensait avoir notre pic, et c'était à peu près le 2 février. Alors, c'était pas si mal. Ça a l'air comme c'est peut-être on a eu le pic. Et j'espère que ça va continuer à aller comme ça. Et ça a l'air comme on a aussi eu le pic pour le nombre de cas. Encore, mais si on commence à avoir plus de personnes ensemble, le nombre de cas va peut-être augmenter, mais j'espère que le nombre de personnes à l'hôpital ne va pas changer tellement, mais on va voir.
Donc, vous pensez que dans ce plan de transition qui a été annoncé et le step 3, c'est le 17 mars, vous estimez qu'entre aujourd'hui et le 7 avril, entre aujourd'hui et le 7 avril, il y aura toujours des hospitalisations, il y aura toujours des cas. Est-ce que vous avez peur que ça remonte aussi un peu?
J'ai toujours un peu peur de ça, mais mais j'espère que non. Et puis, on fait attention aussi qu'est-ce qui arrive, pas seulement ici à l'île du Prince-Édouard, mais ailleurs au pays. Et je pense que la plupart des gens, la plupart des provinces on regarde aussi à peu près Pâques on ne va pas avoir les mêmes mesures en place. On va voir qu'est-ce qui arrive. J'espère que ça va tout aller comme le plan indique, mais on va voir.
Les dates du plan vous pensez que vous allez les modifier ou vous espérez sincèrement qu'on n'y touchera pas?
J'espère qu'on ne va pas les toucher, mais je sais les autres plans, on a touché les dates, mais si on a besoin, on va les changer. Mais j'espère que non. Après le 7 avril, on va avoir encore les personnes à l'hôpital. On va encore avoir les cas, mais ça va être plus comme les autres virus. Ça, c'est qu'est-ce qu'on pense.
Un mot sur le sport. Quelles sont les règles, en gros, que vous avez données au KPI, Soccer PI, à toutes les tournois sportifs, ou du moins le sport interscolaire, toutes sortes de sports? Quelles sont les règles, en gros, que vous leur avez données?
À ce moment, ils sont vraiment seulement... ils ont fait seulement les pratiques avec les groupes moins de 20 personnes. Et puis, après le 17... février, ça va augmenter. Il peut jouer ensemble, mais pas plus de 50 personnes par jour vont faire les mix ensemble. Alors, c'est pas les grands tournois, mais il peut y avoir un jeu contre Charlottetown et Summerside. Et peut-être, ça dépend du type d'équipe. Si c'est curling, il y a plus d'équipes ensemble, mais pas plus que ça. Et puis ça, c'est parce qu'ils font les activités qui n'ont pas les masques, sont plus proches l'un des autres.
My last question, and I'm going to have a question in English for you too. How you visualize, how you see life on PI after April the 7th?
Well, I mean, I guess I'm hopeful that we're able to, on April 7th or somewhere near that, bring an end to most of our public health measures and we creep back into life if we can ever get back to some kind of normal. That's kind of the way I envision it, that we would go about our lives the way we used to, but a little more ever mindful of the fact we've just come through 2+ years of living through a pandemic, and I think we will have the bruises and scars to carry with us from that, to be quite honest. I think Dr. Morrison and I have talked about this a number of different times, that I think there will be an indefinite period of transition for a lot of different people. Maybe for me, for example, I will be flying in an airplane. I will likely wear a mask going through airports and on an airplane, even if it's not the regulated or proclaimed rule. I think many people will find their own individual ways through that to a certain degree, but I expect there will be a period of transition, and I think a lot of the things that we have incorporated into our lives will likely continue for the time being. And I mean, I've heard it said, and I think Dr. Jane talked about this on CBC, that it's a lot like flying after 9/11. We will be cautious. How we fly will be different, was different, and we react to that. And I think that's, a general synopsis of how I envision life. I think a lot of us will be very happy to just get out and get the masks off and get moving around and hug people and all of those things, which we've missed, sorely. But I also think there's going to be a lot of people who are like, let's just be cautious, let's just be careful, and let's make sure we're through this. Because, I mean, you don't do something for 2 years the way we've done it and just brush it off and say it's over. I think, as I say, that we have all some scars and some you can't see from this, and I think they're going to exist for a long time. But I really hope that people aren't getting sick. I really hope that people aren't in the hospital or worse, and that life in PEI in the spring, which is, by my estimation, not so unbiasedly, the best place in the world to be in the spring. And I want people to be here and be careful and to do well and to be ever mindful.
En français?
Vraiment, même chose que le Premier ministre. J'imagine que on va parler plus peut-être la semaine prochaine quand si vous êtes malade et à l'hôpital, c'est là qu'on vous êtes testé pour COVID. J'imagine qu'on va rester chez vous plus facilement si vous êtes malade. On ne va pas aller au travail pour essayer de fonctionner si vous êtes malade, que peut-être on a fait avant COVID. Je suis d'accord, on va peut-être porter des masques plus souvent. Peut-être si on travaille à l'urgence, on va porter les masques au foyer de longue durée. Mais c'est quand même une transition. On parle vraiment de tout ça. C'est une transition. Ça ne va pas arrêter le 7 avril, n'importe quand. On va continuer de travailler. On va continuer de faire la surveillance à propos de COVID. Mais c'est aussi à propos de toutes les maladies communicables. Mais j'espère, comme tout le monde, qu'on peut fonctionner et vivre avec COVID.
Merci.
Merci.
We can move to our friends in the media who are joining us online or on the phone. So,
Gabrielle Drummond, Radio Canada. Good afternoon. Ma question en français pour la Dr. Ed Morrison. Alors, Dr. Morrison, dans le plan que vous nous avez présenté aujourd'hui, vous n'avez pas mentionné les mesures sanitaires dans les écoles de l'île du Prince-Édouard. Est-ce que dans les écoles, on ne va pas retourner à la normale d'ici la fin de l'année scolaire ou on va peut-être créer un plan en parallèle pour alléger graduellement les mesures sanitaires dans les écoles?
Bonjour et merci pour la question parce que vraiment, les détails à propos des écoles et aussi à propos des foyers de longue durée, on va parler en plus de détails peut-être la semaine prochaine, mais on vient vraiment juste d'annoncer un back-to-school plan et puis c'est vraiment seulement une semaine que les enfants sont en classe en personne. Alors, mais absolument, on va commencer aussi la transition avec les écoles, mais on ne voulait pas les annoncer aujourd'hui. On a du travail à faire et puis on va voir qu'est-ce qui arrive pendant les premières quelques semaines aux écoles.
OK, très bien. Et mon collègue Julien, il vous avait posé la question, mais je voulais aller un petit peu plus loin. C'est que vous avez dit que vous ne voulez pas changer les dates dans ce plan de déconfinement-là, dans ce plan de retour à la normale. Mais qu'est-ce qui pourrait vous faire changer ce plan-là, changer les dates ou même les consignes que vous donniez dans chacune de ces étapes-là? Quels sont les éléments qui pourraient faire en sorte qu'on change ce plan?
Merci. Et puis, je pense qu'on a essayé de peut-être répondre en anglais, mais c'est... Dr. Cameron, est-ce que vous voulez essayer en français de répondre même sorte de choses en anglais ou vous voulez que j'essaie?
Je peux bien essayer de répondre en français. C'est une bonne question. Les indicateurs que nous observons, c'est vraiment celui de les hospitalisations que c'est très important pour monitorer. Les autres indicateurs qu'on observe, c'est avec les variants. Si tout à fait, on connaît beaucoup après du Omicron, mais il y a encore beaucoup de choses à apprendre à propos de Omicron. So, si on observe une plus haute sévérité avec les enfants infectés avec COVID-19, ou si on observe les impacts avec les vaccins, si les vaccins, l'effet des vaccins s'est diminué avec une autre lien de Omicron, c'est des choses qu'on va observer.
Ok, très bien, très bien. Ma prochaine question, ça serait aussi concernant toujours sur ces plans-là. J'aimerais juste savoir, Dr. Morrison, si vous pouvez me dire pourquoi ce plan que vous présentez justement aujourd'hui, pourquoi c'est le bon moment de présenter ces plans aujourd'hui, à votre avis, et justement comment vous voyez cette transition à long terme d'ici à l'été et aussi à la saison touristique, parce qu'on sait qu'il y a quand même plusieurs opérateurs touristiques de l'île du Prince-Édouard qui se préparent en ce moment. Alors, comment vous voyez justement cette saison touristique qui se prépare présentement et que ça va être différente cette année?
Alors, en premier, c'est vraiment pour aider tous les insulaires à faire les plans, avoir un peu d'espoir qu'on a les dates. On regarde les indicateurs que Dr. Cameron en parlait pour faire ces annonces de moving on et puis à vivre, transition de vivre avec COVID. Mais c'est important pour les business qui sont touristiques, mais tous les insulaires vraiment, d'essayer de faire les plans pour plus tard le printemps et pour l'été. Parce que c'est important qu'on fait cette transition pour qu'on peut vivre avec le COVID-19. On est plus préparé qu'on a été en avance. On a les vaccins, les boosters. On a même les médicaments pour essayer de réduire les outcomes les plus sévères. Et on connaît bien plus à propos de COVID qu'on savait avant. Alors, je pense que c'est important qu'on réagisse aux cas qui diminuent, les personnes à l'hôpital qui diminuent et le nombre de personnes qui sont vaccinées. Il faut annoncer les changements et puis commencer la transition vraiment. Alors, c'est pourquoi ça aujourd'hui.
Et ma toute dernière question, c'est justement concernant la vaccination, parce que vous avez dit que l'obtention de la 3e dose ou de la dose de rappel, ce sont des éléments quand même assez importants pour cette transition vers la normale. Alors, on sait qu'il y a certaines personnes qui hésitent un peu, peut-être ils vont moins lentement aller chercher leur 3e dose. Alors, ma question pour vous, comment allez-vous faire justement pour encourager davantage de gens à aller chercher la 3e dose? Est-ce que vous pensez que peut-être une campagne de sensibilisation, ça serait important? Alors, comment faire en sorte que les gens procurent leur 3e dose du vaccin?
Alors, on commence une campagne vraiment pour les enfants qui est en train de commencer. Mais c'est vraiment avec l'aide de vous autres dans le média qui m'aide aussi pour vraiment que les gens sachent l'importance du booster pour les protéger contre les severe outcomes qui sont plus sévères. Alors, on parle de ça chaque semaine. On continuer de mettre l'information sur le site Internet. On parle, on a les personnes qui travaillent sur communications qui nous aident. Et puis, on voit les nombres qui commencent à augmenter avec le booster. On a 71% des personnes qui sont dans les âges 60 à 69 qui ont eu le booster et 81% des personnes qui sont âgées 70 à 79. Et maintenant, 88% des personnes qui sont âgées 80 ans et plus. Alors, ça commence, j'espère, d'augmenter le nombre de boosters pour les personnes qui sont trentaine, quarantaine, et cette nombre continue d'augmenter.
Excellent. Merci beaucoup.
Merci.
CBC. Oh, hi. Good afternoon to both of you. So I'm just wondering, Dr. Morrison, you and I have spoken about this before, how it almost feels harder when you're lifting the restrictions than putting them in place. It's almost a more difficult transition. When do we reach the point that, you know, we're almost at that flu level where only people who present at the hospital are tested for COVID-19, you know, when they're ill enough to go to the hospital? When will we see sort of the testing clinics cease to exist and we move to only, you know, treating COVID like the flu, like influenza?
Well, Louise, that is absolutely where, as part of the transition, that's also part of it. So that's the testing and the case and contact management. And I would also anticipate around April that that would be the case, where it would be those who are presenting to hospital, as you indicate, who are being admitted with COVID-like symptoms would be tested. And again, this will be also a transition period, and we'll be certainly speaking to our colleagues at Health PI about what that looks like as well. I think at this point in time, it's our testing is really much tied to our case and contact management as well, and that's a little bit more difficult to look ahead and too far, but that is certainly where we would like to get to. And even our summaries, which we will start putting up on the website, will be very similar to our weekly influenza summaries that we do during influenza season. And so that even in our reporting, it will become different as we go forward.
And so on that note, what about reducing the isolation and testing requirements for COVID positive cases and also close contacts, because that was a more of a recent change where, you know, the close contacts are you know, tested on that day 4. Do you anticipate those rules changing at any time, maybe before that April date, or is that going to sort of be status quo until we're more fully open?
So when I mentioned that we'll be coming back with more details about case and contact management, that is, and the testing, that's part of it, Louise, that speaks to, when we talk about case and contact management, that includes our isolation period. So for instance, one transition at some point in time, maybe just for household contacts to isolate, for instance, that may be another step. But again, we'll be coming back with further details. We thought there was lots of information here to focus on today, and I know Dr. Cameron speaks well to this point too, that most of our cases continue to be close contacts of COVID positive individuals, and so trying to, you know, be careful as we make these steps and ease up a lot of public health measures. We certainly don't want to go too quickly on the management of our close contacts, but definitely that will happen before April.
Sorry, I'm obviously jumping too far ahead on there. Someone had asked me about AstraZeneca. Is it still available on the island for booster shots for those who are allergic to mRNA vaccines?
Yes, as far as I know, but it's not available in all pharmacies. It's only available in certain locations. But we can follow up with you, Louise, if there's with that detail.
Okay, great. And then my final question is just about, we've heard from a number of people who are immunocompromised or parents of children who are immunocompromised. Does COVID-19 pose a bigger risk to those who are immunocompromised than other viruses? Because we know, people who are immunocompromised have had to be very careful with other viruses that are transmitting through the community before COVID-19.
So for those individuals of any age who are immunocompromised, certainly any virus or bacterial infection, if they are impacted, they are at risk for, being more sick than somebody else. And so that's why there's often more protection for those who are particularly high risk. We have certain vaccines, even in our childhood program, for those who are at high risk or immunocompromised that have a different schedule. So that is... And that's also reflected in our COVID vaccine schedule as well, in terms of additional doses for those who are immunocompromised. So I think, and sometimes the word immunocompromised, there's quite we use the definition and the sort of the identification of those who would be considered immunocompromised, and we follow a lot of that definition by NACI. We've also used an immunocompromised list for adults to identify those who really might need some antivirals or the monoclonal antibody therapy as well.
Okay, thanks. I guess I was more looking for, is COVID-19 a bigger risk than other viruses that have circulated before?
Dr. Cameron, I don't know if you want to address that or not, because I know we've had some conversations about it.
Sorry, could you repeat the question?
I was wondering, for people who might have, who are immunocompromised, whether COVID-19 poses a larger risk to their well-being compared to other viruses that have been around longer than COVID-19. And I'm thinking of people who have called in to say, they feel very alone, and especially going back to school, and that they're sort of battling for themselves kind of thing. But whether they are, whether COVID-19 is actually a bigger risk than other viruses.
Oh, thank you. So really, I think from what I have read and heard and seen, really it has to do with the protection afforded by the vaccines as well, and the impacts on vaccine-acquired protection. But certainly, an individual, a case's immune status, whether they're immunocompromised, is considered a risk factor for more severe outcomes to COVID-19.
And Louise, I think what is different about COVID-19 compared to other viruses, that it has not been circulating for years. So we don't have a great deal of natural immunity to COVID-19 or previous strains of COVID-19. And that's why if we can all become, from a population level, well protected from a vaccine perspective, then that will protect us for a long time going forward as well. And it's really based on how well our immunity can protect us, and which allows us to move forward not only over the next few weeks, but over the next months and into next season as well.
Thank you very much.
Okay.
I appreciate that. Have a good afternoon.
Okay. Thanks, Louise.
Guardian?
Hi there, everyone. I guess I'm going to start with a bit of a general question that may not have an answer, but I've been trying to understand why the spread in Prince Edward Island of the Omicron variant proceeded so much quicker. The rates were significantly higher than most other provinces and most other health authorities, from as near as I can tell. So I know we've communicated through email. CBHO has indicated that it probably wasn't driven by workplace spread, but were there other particular congregate settings that really drove transmission of the virus over the last month and a half, 2 months?
Hi, Stu. Well, I'll start and I'll have Dr. Cameron answer as well. So actually, some of the measures we put in place in December actually slowed the transmission of the virus, which is what we had hoped it would do in some of those public health measures. So we didn't see the same steep an incline as they may have seen in other provinces. The other thing that was quite, I guess, different here, which I actually think is a really good thing because it's allowed us to track it differently, that we were able to maintain testing capacity here using a combination of our molecular testing as well as our PCR testing, whereas a lot of other provinces got overwhelmed by a testing capacity point of view and they used up all their PCR ability. So they weren't, their rates of what they showed is in terms of rates of illness were not, they knew didn't indicate the true prevalence in the community, whereas we had a better sense of that here. So I actually think that's why some of the measures that we had in place are helped but we know Omicron was definitely more contagious than in other places. But I don't know, Dr. Cameron, do you want to add to Stu's question?
Yeah, thank you for that. And I think you touched on the important point already, but really it is around the testing strategy. And with the Omicron wave, testing capacity in most jurisdictions became very quickly overwhelmed and they had to adjust their strategy. Many provinces and territories focusing on testing among those most vulnerable. But because we have both PCR and rapid molecular testing capacity here in PEI, we've been able to continue testing individuals more broadly than maybe in other jurisdictions, which is why, with this Omicron wave, looking at case incidents across the country, is really, at this stage anyway, not a great way to compare how provinces and territories are doing against each other. So I would say that we're just able to diagnose additional cases. Other provinces and territories have transitioned to rapid antigen testing as well, providing rapid antigen tests. And the reporting mechanism for those is very much a self-reported reporting mechanism, whether it's a web portal or an email address. And so we know that those are underreported as well.
Okay, thank you for that. Well, I guess my next question is I suppose about some of the outbreak reporting. So, I mean, we've talked about this before. I see that some of the reports for congregate settings that have had an outbreak declared over is now up on the website. But I'm wondering why the choice has been made not to report on the facilities that are still in a situation of outbreak. I mean, wouldn't there be a public health good in reporting that information, say for contacts of people who may work in a long-term care setting, for example?
Hi, Stu, and you're right, we have talked about it before, and we have, and I mentioned in my notes that even if facilities are not, the outbreak is not over, they will be reported on a weekly basis in terms of cases and also active cases that are present in these outbreak facilities. So, and that will be available, if not before Friday, by Friday, and it'll be for ongoing. So that's for your, so that you can look at that every week and see and not wait until an outbreak is over.
Got it. Okay. Last thing for me, I guess, is for the three-step relaxation of public health measures. What if things what are the indicators of something going wrong? I guess, like, let's assume one of the steps has to be delayed, but are there specific indicators you'd look at that might be the key thing that would indicate whether we're on track or not to proceed from step 1, 2, or 3?
Dr. Cameron, I know you've answered this question, I think, Yes. Do you want to summarize that again for Stu?
Sure, yeah, happy to. So, as Dr. Morrison indicated, with opening up, we do anticipate to see an increase in the daily number of cases. However, one of the key indicators to continue monitoring is the number of hospitalizations that we're seeing. In addition to just looking at the numbers, we also look at sort of the demographics around those hospitalizations. So looking for, any sign of more severe outcomes among younger individuals, especially thinking about children, not just locally, but we look at that, nationally as well, internationally. So that would be something to cause us to reflect. As well as we know quite a bit about Omicron, but that knowledge is still growing, and there are new lineages of Omicron now, and so the more we learn about those new lineages and outbranchings and new variants of concern that may emerge, those are other additional considerations that we're keeping a very close eye on.
Okay, thank you very much.
Thank you, Stu.
Sarah Plowman, ETV. Sarah Plowman, ETV.
Sarah might have left us, but I think Julien is volunteering with his hand up to take her place and extend this brief into maybe record levels. So go ahead, Julien.
I just want to clarify something. After April the 7th, no more tests at all of the entries of PI. So what's going to happen at the bridge? Are you going to remove everything?
So that's part of the transition. Certainly, we would, and we'll be discussing this, of course, with all our partners. But we're hoping to, by that date, not have any testing requirement or screening requirement at the points of entry. Now, might there be a time where testing, rapid test kits are available for those who might want to pick them up? Is there, some information available for people? I think those are things that we'll have to address in the weeks ahead before that time. But it's, we're going to, transition in step one with not the isolation, but ongoing testing. And that testing has served us so well. And our points of entry have been so important for us, our journey in this pandemic right from the beginning. And so it will be a transition for all of us to do that. But I think it's an important one to make. And again, just whether there's some sort of option for some availability of voluntary rapid test kits when people come or something, we'll see and see what that looks like.
En français?
OK.
Et après, je vous laisse tranquille.
OK. En français, j'imagine qu'en avril, on va avoir le testing qui est obligatoire, mais peut-être on va en discuter avec l'équipe et les partenaires que ça va peut-être, on peut avoir les personnes qui veulent peut-être ramasser quelques tests qui sont les rapid antigen, les tests, et puis si on veut. Mais j'espère que c'est un moment qu'on va pas avoir quelqu'un. C'est pas obligatoire d'être testé après un bout de temps, après avril.
Allison, you have one more?
Yes, I do. It's one that I was directed to ask at the briefing rather than aim for a statement. So it's regarding post-COVID. So once you've recovered, what are the testing and isolation requirements? So take me through a scenario. So this is hypothetical. So I'm fully vaccinated with 2 doses, and say I contracted COVID on January 6th, and I'm now recovered. But yesterday at work, I was a close contact. So I'm recovered from COVID and I'm vaccinated. But what do I do now? I've just recovered, but I'm a close contact. There's stuff on the website, but it wasn't really specific.
Okay, well, I mean, that's good information because we were trying to make it specific. And Dr. Cameron, I know if you're still there, you can we can remember together to make sure we clarified. If you were tested after December 15th, where most of our cases have been Omicron, and you are identified as a close contact, you would not isolate in the same way. If you, however, were tested positive end of November, you would still need to isolate as a close contact because the likelihood of getting reinfected with Omicron is that much greater if you've had a previous strain. So that's why there's a distinction on December 15th. But if you were positive in the last couple of weeks and you were a close contact, you would not isolate in the same way. And Dr. Cameron, I'm looking up at the speaker. Dr. Cameron, was there anything you wanted to add there?
Now, just to follow up, similar to the isolation period, there's also testing recommendations based on whether you were previously positive or not. Right. And so once again, using that December 5th sort of cut point, if you were diagnosed after December 15th with COVID-19 and you were identified, as a close contact, you don't need to isolate, but you also don't need to test. Testing is not actually recommended for 90 days after a previous positive COVID test result. And that's because, especially with the PCR-based test, you can continue to test positive even though you're well beyond being infectious. But once again, prior to December 15th, what we're really trying to capture and not lose sight of is reinfection. So we know that Omicron poses a much greater reinfection risk. So on December 15th, 90% or more of our cases detected on that day and after are Omicron variant. But before that, if you were infected with a different variant, that risk of reinfection with Omicron exists. And so we continue to advise for testing and isolation for those individuals diagnosed before December 15th.
And just to, I mean, I now have it in front of me, but if you are a close contact, you've had COVID, and you become a close, in the last month, you become a close contact, you still need to monitor for symptoms. And if you get, if you get sick, a symptom.
Follow-up. So about the isolation, you said there was different isolation requirements. So don't isolate or stay away from vulnerable people, or what are the isolation requirements with a recent COVID recovery?
You should, if you are identified as a close contact within 90 days of your positive result, and your date of the positive test was on or after December 15th, you should monitor for symptoms, and if symptoms develop, you stay home until your symptoms have resolved or improving, and testing is not recommended, as Dr. Cameron said, so you would not be isolating in those circumstances, and that's what is outlined on the web.
Okay, so you don't isolate, you don't have to isolate at all if you are recovered from COVID, even if you were a close contact?
Yeah, I mean, we may want to take this offline to help you clarify it. But if you have had COVID and you've had COVID and you've had a positive test and you've recovered, like you have to isolate if you have COVID. Yes. And then, but if you are recovered from COVID and then a month later, like today, get exposed as a close contact, you would not need to isolate. You would monitor for symptoms and stay home.
Okay, perfect. And
can this be the last one?
Yes, thank you so much for indulging this. I've been looking for clarification, and this was the recommendation.
Perfect.
So the same scenario. But I tested positive on December 5th, not January. So this is before the 15th cutoff. I'm to isolate.
Yes, as a close contact and follow the same close contact isolation requirements.
And so testing as well.
The testing requirements. I mean, Dr. Cameron, certainly jump in here. So if it was prior to that, you would still continue to, as a close contact, if you're a positive case of COVID in November and you tested, and you're a close contact, you need to isolate. And whether or not you get tested, it may depend on the type of test too. It's certainly, you may still show positive for up to 90 days, but we're not running into many of those situations at the moment. But yeah, and really we're already in the sort of February, and Yeah.
Yeah, okay. I think that has cleared things up for me. So thank you very much for
welcome.
extending the briefing for my
Okay,
questions.
no problem. And we'll take a look at the language just to make sure it's clear on that. And the COVID, the plan and the steps will be available online this afternoon.
Thank you very much.
Thank you all very much to all of you who tuned in. Dr. Morrison, Dr. Cameron, thank you as well. As you can tell from the detail that goes into this, we are in very good hands with our professionals at CPHO, and I know it gives me, it gives the cabinet, and it gives all Islanders confidence that we're on the right track here. So thanks again, and I appreciate that. And to all Islanders, stay safe.